Good afternoon, friends. Today we're going to talk a little bit about complete dentures over implants. Lots of people are wondering more and more every day. They're wondering, why should I consider implants? Maybe I should just go for complete denture. Does it really have lots of advantages for me to get implants placed before I consider an implant over denture? And a lot of people are wondering and discussing their options, getting various consultations with an oral surgeon, with a prosthodontist, with a denturist, and they come to a conclusion that sometimes they don't need implants and they do fine with a complete upper denture, and those decisions are based either on unwillingness to undergo surgery or an invasive procedure at this time, or perhaps it's the issue of the budget. That's another issue that people run into, and they're considering financial aspects of such treatment, and they may decline such treatment based on various aspects. Nevertheless, an implant retained complete denture has its many advantages, and the main advantage is that it's secured firmly in your mouth, will not come out when you sneeze or cough, when you ski, when you go to a swimming pool, when you attend a birthday party. It's quite secure. You have a peace of mind that nothing is going to slip out and you won't be embarrassed. And at the same time, quality of life increases because you can eat more solid-based foods. You don't have to constantly use blender or mashed potatoes. You can insert more pressure into your complete upper denture without the risk of it slipping out or dislodging or hurting you in the corner. And this is the reason why, the main reason why people narrow their search to an implant retained overdenture. And those overdentures are gaining their popularity worldwide, in Asia, in Europe, in North America. And because of that, we are seeing a drastic increase in implant retained overdentures. Today we're going to briefly cover a complete upper overdenture over 4 implants. This patient here had a complete upper denture before, prior to this, which was an immediate complete upper denture. And that was placed probably about a year and a half and a year and 8 months ago, the immediate complete upper denture. And now the bone resorption had occurred and the tissue has shrunk, and that immediate denture is no longer fitting properly unless it will be relined or rebased. But for now, patient was considering implant option. So we referred this patient to an oral surgeon who places implants. And what happened is here, we have 4 implants placed in the maxillary arch. As you can see, this is a refractory model. You see, it's been cracked in half after processing. And this is a zest type locator overdenture. We have a complete upper denture here. You can see that it's got 4 zest type of locators with a blue sleeve inside. It's got a metal frame, metal cast frame, you can see that, which has been painted with a specific red paint, you see, so it does not show as a metallic background through. When you sneeze or when you're in the pool or when you yawn, people don't want to see metallic base. However, metallic base is seen on the inside of such upper denture because nobody's going to look inside but rather outside. And outside you cannot see it, you see, it's just a shade. Why? Again, for aesthetic reasons mainly. And why we insert the metal frame? Because we don't want to repair this complete upper denture in the future. Quite often, if those implant overdentures are not relined on time and bone resorption had occurred, what happens? It fractures right in the middle, and then you have to repair, you have to reline. Some of the implant parts may be lost. It'll be very cost prohibitive to repair it rather than just insert a metal frame to begin with. Therefore, we consider the insertion of metal frame in this particular case. And sometimes people would like to cut out such palate. They would like to cut out and have a U-shaped palate so they can enjoy food. They have more freedom for the tongue. It's lighter, feels more natural in the mouth, and because of that, people would like to cut out the palate. In this case, we decided not to cut out the palate and rather go all the way back, and we created a functional pose down. A functional pose down for such complete upper denture. Because we want to have good suction, good stability, and we don't want to unnecessarily torque those implants due to excessive mastication. We don't want to torque them too far, and therefore we decided to cover the palate completely. In the future, we can always slightly relieve it if needed. This person does not have a gag reflux, so we decided to keep full palate in this particular case. We decided to go for premium teeth. These are composite teeth, Phaneris 2 Biavocla Premium Composite Teeth. This is what we decided to get. Opposing arch is a cast partial denture with natural teeth and crowns abutments. So this is a perfect case to consider for complete upper overdenture. This person had a complete upper denture in the past. He said, I saved some money. I want to get something better, but I don't want to go for a fixed option. Therefore, we decided to refer this patient to a prosthodontist who placed 4 implants. And after 3 or 4 months, now he had a transitional immediate upper denture, which was a temporary at this point, with a special soft liner so you don't put any pressure on the implants while osseointegration takes place. And what happened now is this is a secondary denture, which is a permanent 4 implant supported overdenture. The patient can take it out, clean it himself. Daily hygienic instructions are quite simple, and insert it back in the morning. Life goes on. He continues to smile, continues to eat most solid foods, and this is the reason why people choose implants more and more in today's removable prosthetic treatment approach. Hope this has helped, and have a wonderful day. Warm regards from Vancouver, and all the best. Thank you.